I am here in Orlando at Ciro World. Ciro World is something unbelievable that's put together by Dentsply Sirona. I can't even say enough about it. If you are not here, you are missing out on continuing education, learning about one-visit dentistry, learning about CIRIC, Galileos, guided surgery, sleep apnea, practice management. I can't believe what's going on. And luckily, I am here with a dear old friend, Tarun Agarwal, but everybody knows you as T-Bone.
T-Bone, yes.
T-Bone. I mean, you are a legend in this realm.
Oh, please, Paul. Speaking of legends, and listen, Paul, I want to start by saying it's Paul Feuerstein, correct?
You got it.
See,
and it's Tarun.
Yes, and I can say your name correctly. See,
that's
I've assimilated.
Bonus points. But your name is synonymous with what's going on in this room. I mean, we've been together since this whole journey started.
Yes.
When you first came in, and you started looking at one-visit dentistry and CIRIC at the time only, and you said, how can I push this to one step beyond? And you've always been really, really on top of this whole thing. Now you're working with guided surgery, you're doing edentulous full mouth reconstruction with these tools, which are just tools, and we'll talk about that a little bit. Well, the thing I like about you, among other things, is
there's something.
Yes, there's a few things. Is you share this.
Yeah.
It's not just you're doing this thing. You're sharing with everybody. You give classes. You give courses. You talk to people. They can call you on the cell phone.
Yeah.
They can get you anytime, including myself. I want to say that in my own classwork, that when I give courses, I show some of the cases that you've given to me as an example of what can be done in this all digital world.
Thank you for that.
And the fun thing for me is I'll show up, I'll have a slide up and I'll say, so this is a case from T-Bone, and I get this big smile in the audience. And I think you have a bigger fan base than Jerry Seinfeld.
No. I'll tell you what, I'd rather have his money.
He did make some funny points. He was at this Sirona event, and it was very funny.
He did a good job.
And again, Sirona, thank you very much for
Dentsply
Sirona. It's only been 175 days.
Yeah, I know.
I have to catch up with it.
They'll forgive us.
So at this meeting and at other meetings, you teach dentists how to do a lot of things. And we're focusing on a few things, but talk a little bit about, just in general, in your practice, guided surgery and how it's transformed the whole genre of doing an implant on a patient from step A to Z without getting too complicated.
Okay. Well, Paul, what I'd like to do for 1 second, if you don't mind,
absolutely.
is you had mentioned that this technology has changed, and really it came out of being selfish, and that I needed to grow my practice. And CIRIC really helped my current patient base, and what I needed to do was expand our patient base. And that's when we looked at imaging to really expand our patient base, go beyond just fillings and crowns, and really be able to do more for our patients, more for our practice to be able to grow. And what we found, and what really led me to that, was I was getting not the right results that I wanted. I wasn't in control. I wasn't getting the right results. I wasn't being able to control the finances. I wasn't getting the case acceptance I wanted. And what I found in the end was I wanted to just be able to do a few cases. And what I've turned out is that I'm doing a lot more than I expected to do.
Far more. And your patients were taken through this journey also, and changed the whole thing. Well, we're going to do a crown, and when do I come back? You don't.
You don't. What's amazing about that, Paul, is we're at a point now where sometimes I forget, because the technology is just so normal to me and my team members.
And new patients coming in don't get this.
They don't get it, right? Even some of my existing patients, they'll look at it and they'll say, oh, wow, when did you get this? I'm like, yeah, those other 3 I did on you? those were done with the same machine. And we just forget to share with our patients
They
sometimes.
never listen. You go on and on. You tell them things. They go, I never knew you.
And they're like, can I floss this one? Or when is this one going to pop out like a temporary? Like it's not a temporary. This is your permanent one. It's done.
Well, there's a lot of marketing involved, and we can learn a lot of marketing right here.
Patients love it. And one of the things that drives me nuts, to be quite honest with you, Paul, is when dentists say, well, my patients don't want this. I go, well, when's the last time you asked your patients? When's the last time dentists asked your patients, do you want to come back? And the answer is no.
They don't want to be there for one visit.
Yeah, they don't want to be there, right. They want 0 visit dentistry, really, is what they want.
Now we're talking.
Now we're talking.
So one of the cool things that you showed me was, I think it was about a year ago, is in literally 2 or 3 visits, you had a patient come in, they needed a molar extract, they needed a bone graft, they needed an implant. So you had a consultation visit, you did the extraction, the bone graft, the implant at that first visit, and finished the restoration at the second visit.
Yes.
Give me a little insight into the workflow there.
I think what happened, Paul, is, every once in a while we get this light bulb, right? And one time I was talking to a patient. I said, how was your implant experience? And she said, you know what, it wasn't that bad, but what happened was I want to go back to how much time it took. She's like, this took me 7 visits to get a tooth in my head.
Okay, it takes a year. I mean,
And all that time, right? But she didn't go about the year. She talked about, I had to take off work 7 times.
Right.
And that's when it hit me. It hit me. It's not just about the money. It's not just about how long it takes to get things done. It's also about how many times the patient has to come into the office.
which costs us money.
But it's not just about us.
No, I understand.
It's also because the average patient takes half a day off each time they come into the office.
That's probably
which
right.
loses productivity. You have to, the stress of getting through traffic. and all of
Even
that.
if they have a 10 o'clock in the morning appointment,
Yes,
they go, I took today off.
I took the whole day off. Even if they have an 8 o'clock in the morning appointment, I take the whole day off, right? And so that's when it hit me. So I went about saying, how can I leverage technology to reduce patient visits? Now, the byproduct of that is obviously when I reduce patient visits, I reduce my costs as well. So what I'm looking for is how can we take the technology and reduce the number of visits? So why do we have to reschedule a patient? Now, why can't we work through lunch sometimes? Why can't we create an opportunity within the schedule? Why can't we have scheduled time? Why can't we ask the patient?
But you're focused on the practice. Some dentists are not, and that's a big deal too.
But then why are you there?
Tell me.
Yeah.
I mean, this is what we see all the time. The dentist goes, "Oh, great! I have a cancellation. I can leave early today." What kind of an attitude is that?
Well, it's interesting you say that. I remember when I was an associate, I used to like playing golf, and I would always want to leave early and play golf. And what I found was I did it once, and the next thing you know, the team at that place. Suddenly, I never had 4 o'clock patients.
Yeah.
So I could always leave early, and then next thing you know, they were leaving early, right? And next thing you know, I got a phone call from the owner saying, "Hey, what in the world's going on over there?"
So let's just jump a little bit here. I want you to talk to me a little bit about how you would do a little bit about full mouth reconstruction in the dentulous situation. Number
Okay.
one, just we don't need a whole dissertation.
Sure.
But also talk to me about sleep apnea while we're at it,
Great.
and some of the tools. I'll call them tools for lack of a better word, but we'll go back to that in a few minutes.
All right, so let's start with the edentulous patient. Here's what we know. Roughly a quarter of our adult population over age 65 is going to be without teeth. Okay, we're living longer, we have a little bit more disposable income, we want a solution. Okay, I believe the general dentists should quarterback cases. Maybe they're not surgically capable of doing the dentistry. Okay, but they need to partner with a surgical specialist, or they can do it themselves. They can leverage technology to plan out the case, know exactly what's going on. And now with digital planning, we know where the teeth are going to be, we know what they want to be, we know how much bone we may need to reduce, we know where the implants are going to go. Suddenly we can start making things that were more complicated, all these components that we used to have, suddenly we can pre-plan.
And you can pre-plan by placing the teeth first.
Yeah, everything's. Listen, at the end of the day, nobody comes to your office saying, "Hey, I want 4 implants." Yeah. Okay, they come saying, "Hey, I want teeth. I want a smile that stays in my head." Right. So the implants are just a method of getting the teeth. Okay. So ultimately, it's about knowing what you're doing, and then eventually, it's like an erector set. Once you plan everything out, it's just doing the process. Right. Okay. Step 1, we do the bone, we do the guide, we do the implants, we do the components, we do the teeth. Okay, but it starts from a backwards process. Okay, and then it just works great.
That just makes things that work so well. And so what I hear sometimes, and we know I'm kind of leading us on here, but so a dentist says, "Are you kidding me? I have to pay for a CIRAC and pay for a Galileo's." Are they paying for that really?
Well, I mean, in a way, sure, it comes out of your bank account, but at the end of the day, listen, these things are lead generation tools, they're production tools, they create revenue, they create things that you weren't doing before. So, but here's the challenging part for dentists to get their heads around. If you want to do fillings and crowns, and that's all you can imagine yourself doing, then maybe 3D imaging is not for you. But if you want to do something more than fillings and crowns, if you want to tap into the potential that's already in your practice, let's think, you asked me about sleep apnea.
Sure.
Okay, I want to use that as an example. And tell me if I'm getting off track here,
No,
okay?
you're on your own.
So here's what we know. 1 in 15 adults in the United States suffer from sleep apnea.
Absolutely.
The average practice in this country sees 30 adults a day. Okay.
So you're seeing people with
so
sleep apnea.
So there's 2 by mathematics alone. And listen, that's in the skinny part.
Sure.
Like in North Carolina and people like me, there's more than 1 in 15. Okay. So that's 2 people per day in your practice that have sleep apnea. We know that. Multiply that by 200 days a year. That's 400 people in your practice that have sleep apnea. Oof. 400. Average reimbursement for a sleep apnea appliance is $2,500. Okay,
Actually,
that's
maybe where you live.
yeah, so that's $1 million. It's in your practice today.
Wow.
Okay, and
Wow.
I would bet to I would take a wager that the vast majority of people listening to this are doing between 0 and 5 appliances a year. But yet
probably
there's
right.
400 appliances sitting in their practice right now.
And with things like SciCat and Galileos and the whole workflow there, it makes it pretty easy.
Yeah, and ultimately, Paul, what I tell everybody is those are tools, right? Like you said. Because it starts with what? It starts with creating awareness. Our number one challenge in everything we do is we've got to create awareness for the patient, right? The patients don't want to do anything if they're not aware they have a problem. And that's how I look at 3D imaging. It's not diagnostic, okay? Nobody's going to tell you diagnose sleep apnea with 3D imaging. It's simply not true, okay?
It's a tool.
It's a tool to create awareness. When you can put a color image on a screen and you can show your person, this is what your airway looks like, this is what's going on. Let's take a look. Let's take a closer look. Let's get a sleep study, whether that's in a lab, whether that's with a home study. Let's take a closer look. Let's see how we can help you. Okay, and then the pieces just fall into place once you create that awareness. And of course, we have a digital workflow to make digital appliances. But if you don't create awareness, you can't get down that road.
We could just go on this for a couple of hours, couldn't we?
I would love to.
But I think we're running out of time. Okay. We'll have to do this again. You know what? You're just so enthusiastic.
I love what I do, Paul.
And I'm at a point, I'm a little older than you, and people say to me sometimes, a little, just a little, and they go, when are you going to retire and leave? I said, why would I want to? There's so much going on here. I look forward to coming to the office and seeing some new process, some new thing. It's exciting to go to work.
Yeah, no, listen, and see, that's the beauty of all this technology. Okay, I look forward to going to work most days.
Yeah, of course.
Okay, most days. I'm not going to say every day, okay? Let's not lie, okay? We all have those days.
Sure.
But I didn't look forward to going to work when I was just doing fill-ins and crowns.
Right.
Okay?
Right.
But when you're doing things that get a reaction, I try to be funny, okay? When's the last time you worked on a patient that got up out of the chair and said, Paul, thank you for MODing me today. That was the best MOD I've ever had in my life. Right? But when you can help somebody with sleep apnea, when you can help somebody with implants and chew, and you can change their life, now suddenly there's satisfaction in our work we do. And that's really what makes you come in. It's not the money, it's not all of those things. Those things just happen.
It just comes.
It just comes with time, okay? But when you can really change somebody's life, you start loving what you do, and your team starts loving what you do, and things just start falling in place. So I encourage dentists to just explore what's possible out there.
Well, you know what, Tarun, T-Bone, I got to tell you, what a pleasure.
Thank you
so much.
What a pleasure.
Always great to see you.
I love you.
Thanks so much.
Thank you so much.
Oh, wow.